Let's start out with the fundamental functions of the lungs. The respiratory system is organized into two main zones, the conducting zone and the respiratory zone. Each of these zones has its own distinct role that collectively enables ventilation and gas exchange. First, the conducting zone. This zone consists of structures that serve as passageways for air to enter and exit the lungs. However, they are not directly involved in the exchange of gases between the air and blood. Instead, the conducting zone's primary function is to filter, warm, and moisten incoming air, preparing it for gas exchange. Key structures here include the trachea, bronchi, and larger bronchioles. The respiratory zone is where the actual gas exchange occurs. This zone includes the respiratory bronchioles, alveolar ducts, and alveoli. These structures are designed for the diffusion of oxygen and carbon dioxide between the air in the lungs and the blood in the pulmonary capillaries. Let's look at the general form of the lungs. Each lung has a conical shape that is rounded at the top and wider at the bottom. This shape supports maximal lung capacity while allowing the lungs to fit comfortably within the thoracic cavity. Inferior to the lungs is the diaphragm, which is the primary muscle involved in ventilation. The diaphragm forms the base of the thoracic cavity and separates it from the abdominal cavity. During inhalation, it contracts and flattens, creating a negative pressure that draws air into the lungs. Its role is absolutely necessary for efficient ventilation as it drives the bulk of the respiratory movement. The apex of each lung is the topmost part, extending just above the first rib and slightly above the clavicle. This area is important as it sits close to major blood vessels such as the subclavian arteries and veins. At the opposite end, you have the base of the lungs, which rests on the diaphragm. The concave shape of the base of the lung allows it to fit snugly against the diaphragm, which is slightly higher on the right side due to the liver sitting beneath it. When comparing the right lung versus the left lung, there are several appreciable anatomical differences. The right lung is slightly larger and divided into three lobes, the superior, middle, and inferior, whereas the left lung only has two lobes, the superior and inferior. This asymmetry exists because the heart is located slightly to the left, reducing the available space on the left side of the thorax. To accommodate the heart's position, the cardiac notch is present on the left lung. This is a concave indentation on the medial side of the left lung that allows room for the heart. The cardiac notch is a great example of the unique fit of organs within the thoracic cavity, where each structure is adapted to function alongside other neighboring organs. The lungs are further divided into bronchopulmonary segments. These are subdivisions within each lobe, each segment supplied by its own tertiary bronchus and blood vessel. This segmentation allows for greater control of ventilation and blood flow within the lungs. From a surgical perspective, specific bronchopulmonary segments can be removed or treated independently, preserving as much lung function as possible. Surrounding the lungs are the pleura, which help keep the lungs inflated and lubricated, ensuring their smooth operation. The visceral pleura is the inner layer of the pleural membrane, which is tightly adhered to the surface of the lungs. The visceral pleura covers each lung and follows all of its contours, including the fissures between lobes. The parietal pleura is the outer layer of the pleural membrane, which lies the inner surface of the thoracic cavity, the diaphragm, and the mediastinum. It creates a protective compartment around each lung. Production of pleural fluid occurs between the visceral and parietal pleura within the pleural cavity. This fluid reduces friction as the lungs expand and contract, facilitating smooth respiratory movements within the thoracic cavity. Compartmentalization by the pleura helps isolate each lung within its own cavity. The separation provides protection. If one lung collapses or is injured, the other lung can continue functioning independently within its own pleural cavity. The pulmonary artery is the main vessel supplying deoxygenated blood from the right side of the heart to the lungs. It branches extensively within the lungs, running alongside the bronchial tree, and ultimately divides into smaller vessels that reach the pulmonary capillaries surrounding the alveoli. Pulmonary lobules are small functional units of the lungs, each supplied by its own branch of the pulmonary artery, ensuring that deoxygenated blood reaches these areas of gas exchange. The pulmonary capillary network forms a dense netting of capillaries surrounding each alveolus. This proximity to the alveoli allows for the rapid exchange of gas, with oxygen diffusing into the blood and carbon dioxide diffusing out. Pulmonary veins collect oxygenated blood from the pulmonary capillary network and return it to the left atrium of the heart. Unlike the systemic veins, which usually carry deoxygenated blood, pulmonary veins carry oxygen rich blood, which is then pumped out to the rest of the body to meet its metabolic demands.